There's financial leverage in pooling together you can pool together with 4 or 5, 50 organizations and still find financial leverage, but you have to still manage what's in the pool. And that's the true difference maker. When we see CEOs and organizational leaders actually outperforming the healthcare market, it's their mindset. They're committed to doing things a different way. They're data hungry. They want to understand what is the leading indicator for them to change that outcome going forward.
So what you're really describing is, it shouldn't be, but it's kind of a next generation leader, right? Somebody who actually says, I'm not intimidated by this, rather than shy away from it. I'm going to dive in and I'm going to get all the data I can. I'm going to make all the decisions I can. And I love it when people say that very, very successful people are inherently control freaks, because it so often works, right? It's like, of course they are, right? Because if they're in control, if they measure stuff, then they can manage it.
Yeah. I think another attribute of this entire group, or those frustrated CEOs, and I've sat in a number of boardrooms and a number of presentations and a number of angry phone calls about, are you kidding me? My renewal is X. And you never told me, I didn't know, all the emotions that come with that. And being part of an organization like these leaders who've come together in these groups, there's counterintuitivity in their thinking. And I'll never forget one CFO. It was a law firm in downtown Denver. That's where I live. And we were describing this deconstruction of how to deconstruct a large insurance, find better value in supply chain, specifically around prescription drugs, pharmacy benefit management. It's an easy one to pick off because it's a commoditized product for the most part. And he said, I get that we can break this down, John, but it's counterintuitive to me to believe that I, the managing partner of a 300-employee law firm, can buy drugs at a lower unit cost than X large insurance company. And it's hard to say you can, and this is how it's done. They have to believe it. They want to have to go in and say, I can do this. But there's so much bias out there that only large things can drive value in healthcare. It's just not true.